Headspace is a relatively new organisation. It's been around for about 5 years. It was established by the Howard government and specifically focuses on early intervention for 12 to 25-year-olds. By early intervention, we mean things like anxiety, stress, depression, issues around body image, a whole range of things. And it's set up in such a way, we have centres all across Australia, and it's set up in such a way that a young person can walk in and they don't need to have a referral from a GP, they don't need to actually self-diagnose, they can just come in and say, I feel like crap. That's essentially what we set it up for. We've seen in the last 5 years nearly 50,000 young people. We've got funding from the federal government now to go to 90 centres nationally, so we're currently 30, about to go to 40. So we've got centres ranging from Perth and Broome and Darwin, right down the east coast, all through Victoria and in Tasmania and South Australia. So quite extensive. We also have got online counselling and a whole range of other things that we do as well. So Headspace is quite unique. It's a very unique model. It's the only one of its kind in the world. And there have been other countries, particularly Ireland, who've looked at the model and are trying to implement a very similar model in their mental health system for young people. So that's essentially what Headspace is about.
Hi. Lantern is a community managed mental health service in the southern suburbs of Melbourne. We've been running for about 15 to 16 years. Predominantly we deal with fairly significant mental health issues in a range of ages from 16 right through to 64. Of particular interest to us in recent years is it's become very apparent that there's a significant issue around youth and mental health issues, and in particular about help seeking for that age group. And of particular awareness to us in our area, but really more broadly across Australia, is that 1 in 3 young women from 16 to 25 are now experiencing anxiety or depression, and that was a really alarming figure. It's 1 in 4 young people who have a mental health issue these days. So in response to that, Lantern has developed a lovely program called Blossom Project. And Blossom Project is really about supporting young women who are having issues, feeling sad, feeling anxious, worrying a lot, struggling, basically to provide them with a 10-week program that supports their resilience, their coping skills, really gives them a place where it's safe to share and to listen, to be listened to. It's a non-clinical program. It's new. It piloted last year and it's still in the developmental stages, and we'll be launching a Blossom Project website later this year. And the 10-week model we hope to expand right across the state and Australia in due process. So very wonderful work that's going on at the moment, and in a really much needed area of for young people. So we very much, Blossom Project is about, as Elizabeth was saying, the importance of early intervention and prevention, and the importance of seeking help early. And Blossom Project supports young girls to break down those barriers. It helps to break down the barriers to help seeking.
Hi, I'll just correct, I'm actually not a researcher. I'd love to be a researcher. Sounds like a good job. No, that's okay, just so I don't misrepresent credentials at all. I'm a board member at REACH, and REACH encourages all young people, no matter what their circumstances, to believe that they can achieve. So we work with both those who are trying to survive, who might be facing things such as depression or anxiety, but also those who are ready to thrive. So everyday kids who may just be losing interest in school, or not quite finding their groove with things, or maybe falling out of touch with a social circle, to help them get back into that before they sort of slide down those challenges. So what we do is very much focus on prevention and early intervention, and we do that through programs that create support and build self-belief to help young people achieve their potential. At the heart of our approach, our focus is young people inspiring young people. So we select and train young people, normally between the ages of 15 and 25, to help deliver the programs in schools. We work in 500 schools around Australia. We see about 57,000 kids every year through our programs, and we work closely with teachers and parents and communities so that when REACH isn't there anymore, some of the support systems in their environment are changing to help them as well. Some of the research that we have shows that what REACH does is help improve things like self-esteem, optimism, the feelings that they can have some control over what's happening in their lives and on circumstances around them.
Hi everyone. Lifeline, I'm here representing Lifeline today. Lifeline's been around for about 48 years. It was started in Sydney 48 years ago by the Reverend Sir Alan Walker. Alan Walker received a call from a man who told him that he had written him a letter, and by the time he'd received the letter on Monday, he'd be dead. That actually happened, and Alan Walker decided at that time that he was going to start up a service to enable anyone who needed emotional support to be able to talk to someone. He set up Lifeline, and basically that 24-hour crisis support phone service has been ringing ever since. Lifeline answers about 450,000 calls a year, about 1,200 a day from people in crisis. About 8% or about 40,000 of these calls a year are from young people. Excuse me, 24 years or younger. I'm going to talk about some of the issues that the people call about as part of this forum today. But more recently, we've started a online crisis chat service as well. The MLC Community Foundation are our largest private funder of that service at the moment, and we're completing that trial at the end of August. But we've also noticed that 60% of our contacts through this trial are youth, 24 years and younger, and also a significant group of people from the ages of 15 to 19 as well. The issues that they're calling about, that they're contacting us about online are varied, but we are finding that young people are much more comfortable to talk about their feelings around suicidality in this space. So I'll talk a little bit more about some of the issues facing young people through that support mechanism as well.